You're listening to Health and Communities. Your hosts today, Dr. Elena Pedraza and Chris Park, are virtual voices designed to reflect the diverse experiences and expertise of Jefferson's health data science community.
Hello, Chris. Today's episode features original research conducted by real Jefferson students in our health data science program, addressing critical population health challenges. Let's start by considering a significant challenge in modern healthcare. The Medicare Shared Savings Program, or MSSP, aims to incentivize healthcare providers to deliver more coordinated, efficient care. But the problem is achieving the cost savings and improved outcomes required by MSSP remains extremely difficult for most organizations. Providers, as you know, often face the pressures of packed schedules and limited resources, which leaves little room for meeting these demanding benchmarks.
Right, Elena. And isn't that where data analytics steps in? Because it's not just about working harder, it's about working smarter with the data available to make those improvements.
Exactly. But there's been a gap. Healthcare organizations often lack a clear framework for identifying the key factors behind their successes or frankly, their failures in adapting to value-based care models. That's where advanced analytics becomes transformative. And in Jefferson's health data science program, we challenge students to take these kinds of real-world healthcare problems and tackle them head-on through a Capstone project. A capstone is a culminating project where students bring together everything they've mastered, from exploratory data analysis to machine learning to creating visualizations that inform decision-making. Take Gurung Lee's capstone, for example. She analyzed data from over 400 accountable care organizations to pinpoint the most critical success factors for achieving shared savings under the MSSP.
That's a massive data set. How'd she even start breaking down something that complex?
She began with exploratory data analysis, examining trends like admissions rates and specialist utilization to identify patterns. From there, she applied classification models and logistic regression tools that helped determine which factors were statistically significant. And the results were fascinating.
Like what? Can you give an example?
For instance, her project found that ACOs performing well tended to have fewer avoidable inpatient admissions and emergency department visits. Interestingly, physician-led ACOs also benefited significantly from larger ratios of primary care providers versus specialists. Chris, it's insights like these that give health systems actionable strategies to improve both patient care and financial performance.
And it's not just a spreadsheet exercise either, right? I mean, we're talking about real improvements, like which patients get better care and which hospitals can stay financially afloat. It really puts this data work into perspective.
Precisely. And even broader than that, it demonstrates how health data science can guide critical decision-making across the entire health system. Decisions that have tangible impacts on both operational efficiency and patient well-being. Her work shows that success comes through a systematic approach to managing resources and aligning care strategies. And Jefferson's health data science program empowers students precisely for challenges like this, combining technical acumen, strategic focus, and real-world applicability.
Okay, building on that, when it comes to using data analytics to identify those success markers, how do you even start making sense of such a complicated data set?
Tools like Click and Microsoft Power BI come into play here. These tools allow analysts to visualize data effectively, transforming rows of numbers into trends and insights healthcare leaders can actually act on. As we said, Gurung began with exploratory data analysis, or EDA, a method that helps identify patterns in data. Among the patterns she discovered from that analysis, she found connections between avoidable inpatient admissions and SNF admissions, whether an ACO achieved shared saving.
SNF admissions, you mean skilled nursing facilities, right? So what does that tell us?
Well, high rates of admissions were associated with lower chances of achieving shared savings. But when ACOs managed to reduce these avoidable admissions, they significantly improved their performance, both clinically and financially.
Got it. So fewer sniff stays equals a better shot at hitting those cost savings targets. Now, how do you show that in a way people can quickly understand?
That's where visualization tools shine. Gurung used Power BI to create dashboards that highlighted key metrics for efficiency, like readmissions, inpatient visits, and PCP to specialist ratios. With these visuals, decision makers could see where their efforts were paying off or where improvement was needed. Her findings in the Capstone project, the importance of monitoring avoidable admissions, addressing chronic disease management, and strategically managing specialist utilization, go beyond raw data. They become strategies healthcare leaders can adopt to enhance value-based care.
And that's what struck me the most. This work isn't stuck in some spreadsheet, it's driving real conversations about how to improve care. And that's the whole point of health data science, right?
Yes, the field merges statistical and analytical rigor with practical healthcare applications, aiming to create strategies that not only save costs, but also improve patient outcomes and equity. And it's students like Gurung who show how data, when used thoughtfully, can genuinely transform healthcare. She's analyzing nationwide trends, opening doors for future interventions that improve care equity and operational efficiency.
I love that. It really shows how health data science can snowball into something bigger. Like her work is planting seeds for better policies down the line.
The intersection of data science and healthcare is driving profound change, and this is only the beginning. For prospective students, it's a chance to build the skills needed to shape the future of value-based care and make a meaningful impact on both systems and lives.
Couldn't have said it better myself. And with that, it's time to wrap up this episode. It's been so great diving into Gurung's Capstone and the incredible work being done in Jefferson's Health Data Science Program.
Absolutely. Our goal today has been to share real-world solutions developed by Jefferson students to inspire future leaders in population health. Thank you, Chris. And to all our listeners, stay curious, stay engaged, and keep leveraging data to make a difference. Until next time.